the importance of Vata and some important Vada Vyadi Lakshana and the Chikilsa we have seen. In Charaka Samhita, we will have some more details regarding the diseases caused by Vata. The topics which are already described in the Ashtanga Hridaya Vata Vyadi Chikilsa will be just mentioning here, will not be explained in this class. We will go a detail uh, of Vata Vyadi Chikilsa, which is specifically mentioned by Charaka. Same as in Ashtanga Hridaya, Charaka Samhita also explains the importance of Vata. Vayu is considered as the Vayur Ayur Balam Vayur Dhata Sharirina Vayur Vishwamidam Sarvam Prabhur Vayushcha Kirtidaha. Acharya says everything is Vayu. Vishwa is Vayu. Vayur Vishwamidam Sarvam. Everything is controlled by Vata. Everything is everywhere. It is Vata is dominated. Vata itself is the strength and sustainer of the body. So very importantly, Vata causes the diseases as well as Vata sustain the life. Acharya Charaka has added one more thing regarding the Ayu. Vayu is very, or Vata is very much closely related to Ayus. That is, if a person can control or if a person can maintain healthy Vata, he can live long. The longevity will be increased. That is what Acharya Charaka says. Once a person, if he can maintain the Vata in a proper way, he can live for hundreds of years without any diseases. By that, we can understand that all the diseases, all causative factor for all the diseases is Vata in a dominant way. And some basic things we might have learned in the previous years or previous class or beginning of our BAMS or Ayurveda academics, that 5 divisions are there. We have studied 5 divisions of Vata, 5 divisions of Pitta, and 5 divisions of Kapha. Therapeutically, 5 divisions of Vata is very important because wherever we see the functions of Vata or abnormalities of Vata, the site of vitiation, the dosha vitiation is important. Secondarily, the site of vitiation of dosha is very important. Similarly, in the physiology also, Vata is having some role or some major role in our life, in our life activities. Different sites or in different places, Vata acts differently. By the position or by the action of such different places of Vata, we conveniently divide into 5. That is what Prana, Udana, Samana, Vyana, and Apana. So, before going to the Vata Vyadi, understanding of Vata Vyadi, Acharya Charaka has highlighted the importance of 5 divisions of Vata. First one is Pranavata. As we all know, Pranavata is located in the mainly in the Murtha. Other locations of Pranavata are Sthanam Pranasya Murtha, Ura, Kantha, Jihva, Asya, Nastika. Above neck. Above neck is the above neck, head, chest, throat, tongue, mouth, nose. All the Indriyas are the site or location of Vata. Similar way, the functions also. It functions as Shiva, Shavadu, Udgara, Swasa, Aharadi Karma. Aharana is something, the procedure of eating. Aharana, breathing, respiration. Udgara, Shavadu, Stevena, spitting, sneezing. All this functions are controlled or led by Pranavada. So these functions are attributed to Pranavada. While going to the next one is Udanavada. Udanasya punasthanam Nabhi Urakantha evacha. Nabhi Urastha Kantha are considered as the sthana of Udana. We can have some this sloka in the slides. Okay, Anlo. So this 5 divisions. First we have seen the Pranavada. The second one is Udana. Udanasya Thanam Nabhi Ura Kantha evacha. Nabhi Urastha Kantha are considered as the location of Udanavada. And the functions of Udanavada goes like Vak Pravritti, Prayatna, Urja, Bala, Varnadi, Karma. This Udanavada is responsible for the speech and the activities, effort activities, and the energy, enthusiasm, complexion, etc. are by Udanavada. And next is Samana. Samanavada, we can see the this is about the Samanavada. Location of Samanavada. Sweda Doshavaha Srodas, Svedavaha Srodas, Doshavaha Srodas, and Ambuvaha Srodas are considered as the location of uh, Samanavada. And the function is regarding the Agni. It promotes the Agni or it promotes the digestion. And it located in the Andaragni or the digestive enzymes, whatever the materials responsible for the digestion and metabolism. So Samanavada will function to increase or improve the digestion and metabolism. While we are moving to the Vyanavada. Vyanavada is located all over the body. It moves all over the body. Its function is Gati, Prasarana, Akshepa, Nimeshadi Kriya. That all these movements, movement and such kind of activities are managed or controlled by Vyanavada. Next, we will move on to the Apanavata. Apanavata is located in the lower part of body. Vrishana, Vasti, Metra, Nabhi, Uru, Vankshana, Guda. These are the sthana or location mentioned for Apanavada. And this by by staying in this location, Vata will act or will do the karma or activities of such places like ejaculation of semen, avoiding of urine and feces, menstrual blood. It is responsible for elimination of menstrual blood, and it is responsible for elimination of fetus, delivery, labor. Such activities are managed or controlled by Apanavada. Next, we will move on to the etiology. We will move on to the etiology of Vada Vyadhi. This we have seen already in the last class. I will brief about this, and additional points will be mentioned here. Ruksha, Sita, Alpa, Lakhu, Anna, Vyavaya, Ati Prajagarehi. These are the activities which increase, which vitiate Vada. Intake of Ruksha Ahara, Ati Sita Ahara, or taking less Ahara and having very excessive activities, Vyavaya, and Adi Jagara, having no sleep in the night time. This will cause the vitiation of Vata and thereby cause Vata Vyadhi. Next line says about some therapeutic measures which can lead to the vitiation of Vata. Vishamad Upacharashta. Some therapeutic measures what we use in the for the patient that can also cause the vitiation of Vata. Dosha Asrak Shravanadapi. Adisravana. Adisravana of Dosha Asrak. It is here it is Dosha Shravanadapi. Spelling mistake is there. Dosha Shravanada Adi. Adisravana of Dosha, Adisravana of Rekta, etc. will cause the Visheshana of Vada. Langhana, Plavana, Adva, Vyayama, Adi Vijeshtada. These activities, Langhana, Plavana, swimming, such activities, if do in excess, that will also cause the Visheshana of Vada. Dhadunam Samkshayat, Chinta, Shoga, Roga, Adi Kashanat. Chinta, Shoga. Psychological factors. Next mentioned is psychological factors. Including the dhatu kshaya, the causative factors. Any causative factors for dhatu kshaya will lead to vadavritti and thereby vadavyadi. Chinta, shoka, dukkha, etc. Emotional factors will also cause the visheshana of vada. Then other diseases, the excess dhatu kshaya will happen, or other diseases also will lead to the Visheshna of Vada. And Vega Sandharana. Vega Dharana is one of the major factor or the etiological factor for Vada Vyadi. Vega Sandharana. Amat, Abhigadat, Abhojanat. Abhojana mentioned earlier. Amad, Abhigadat. Ama is also a cause for Visheshna of Vada. Ama will cause the avarana, or the gati will be obstructed. Vada, gati of vata will be obstructed, and thereby visheshana of vata will be happening. In the other conditions, usually dhadukshaya or that thereby visheshana of vata will occur. In this condition, ama, medas, etc. will obstruct the gati of vata, and thereby vata will be increased. This another samprapti, the coming two lines samprapti, we have already seen. Wherever the emptiness will happen, there will be increase of vada. Srodamsi riktani. That rikta srotas will be purayitva anilobili. That will be filled with the vada. Then it will cause karodi vividhan vyadin sarvanga ekanga samsara. This will cause sarvanga and ekanga, located localized or generalized diseases of vata will be occurred by the this activity. This is the samprapti. Next, we will move on to the Purva Rupa and Rupa. Purva Rupa mentioned here is Avyaktam Lakshanam Tesham Purva Rupam iti Smritam. Usually, some people interpret it as Avyakta Lakshana. Avyakta Lakshana is not manifested Lakshana. We need to understand the meaning of Avyakta Lakshana. Avyakta Lakshanam Tesham. Avyakta Lakshanam, Avyaktam Lakshanam Tesham. Tesham Lakshanam. Tesham Lakshanam means the Lakshana of Vada. That is mentioned in the following sloka. The Lakshana mentioned in the Vada Vyadi or Visheshna of Vada, that will be appeared in an unclear manner. That is, something will be there. We will not be clear. We cannot be clear about that diseases, or the understanding of the symptom. Very clear cut manifestation will not be there. But the same symptoms, whatever the following symptoms, Sankojam, Bhedam, Romaharsha, Pralabham, Shosham, etc. These kind of symptoms, pain, etc., any kind of symptom, that will be appearing in a very mild form, and it cannot be distinguished or clearly manifested. That is the Purvarupa. That so Avyaktam Lakshana Tesha means whatever Vadavyadi Lakshana is there, whatever the Vadavyadi is going to be occur in a body, that Lakshana will be observed or seen in the patient, but it will be in the mild form. And next is Lakshana. Next is Lakshana. Sankojam Parvanam Stambam Hedo Astinam Parvanam Abhi. The different type of pain, different type of manifestation. Sankojaha Parvanam Stambo. Sankoja is the contraction or constriction type of catching type of pain. Parvanam Stambam. Parvanam is joints. Parva is joint. Parvanam joints. Parvanam Stambam. The stiffness of joint will be there. Bhedo Astinam. Severe breaking type of pain in the bones. severe breaking type of pain in the bones. Bhedo astana parvanamabi, same in the joints also. Lomaharsha pralabascha pani prashta shirograha. Lomaharsha will be there, horripilations will be there, pralapa can be there, delirium will be there, pani prashta shirograha. Pain in the pain and spastic condition, that is stiffness or pain in the pani prashta shiro, pani prashta and shiras. These organs will be having pain or catching or stiffness will be there. Another third line is mentioning about the diseases, that is khanja pangulya kubjatvam shosho angana anidrada. Khanjam, pangu, kubjam, these are the manifestations of increased vada, symptoms of vada-vyadi. Khanjam, pangu, kubjam, chosho anganam, anga chosham will be there, anidrada, sleep disturbance or uh, uh, sleep, absence of sleep will be there, anidrada will be there. Garbha, Shukra, Rajo, Nasha. The vitiation of Garbha, Shukra, and Rajas. The reproductive capacity will be affected in all means. Garbha, Shukra, and Rajas. In the female, in the male, and also and in the manifested fetus or inside the womb. The life inside the womb also will be affected. Spandanam, Gatra Suttada. Spandanam will be there. Tremor, the pitching sensation will be there. Gatra Suptada will be there. Gatra Suptada is numbness of the body. It can be localized or generalized. Tiro Nasta Akshi Jatrunam Grivayaschabi Hundanam. Hundana is the word used to denote sometimes pain, sometimes roughness or like catching type or dryness, like that. It is mentioned Hundana, the word is used. Tirunasa Akshijatruna Grivayaschabi Hundanam. Different areas, the Hundana, the word is used for denoting such symptoms in different areas. Shiro Hundana is the catching or the catching type of pain in the shiras, nasa, akshi, jatru, etc. The same type of feelings are there. Griva Gundana. Griva, usually whatever we see in the cervical spondylosis, Griva Gundana, stiffness of neck, inability to move the neck or pain while moving the neck. That Akshigundana denotes the weakness of eye. That is the different movements of eyeball will be affected. Such kind of symptoms are included under the word Kundana. So Shiro, Nasa, Akshi. Then weakness, general weakness, some tiredness, some kind of tiredness, a catching type of pain, inability to move. That all these kind of symptoms can be attributed to the word Kundana. So Shiro, Nasa, Akshi, Jatrunam, Grivayaschabi Kundana. Bheda Toda Arti. Bheda Toda Arti. Akshepo Mohasta Mohasta Ayasa Evacha. This kind of section. Moha, Ayasa, Bheda, different type of pain. Bheda, Toda, etc. are the different type of pain. Same pain will be there and patient may go unconscious. Mohasta Ayasa will be there. These symptoms can be seen in the Vada Vyadi in general. This is Vada Prakopa occurring in the body, and this will cause the Vada Vyadi. This is the Lakshana in general. Before going to the Samanya Chikitsa, we have seen Vada vitiation in different places. What will happen in different places, Vada Prakopa? Just I will mention all these things. We have whatever we have seen in the last class. Koshta, Vada located in the Koshta will cause the retention of urine and retention of feces. Koshta Gadavada is located in the Koshta, which cause the Nigraho Mutra Varchas. So Nigraha of Mutra and Varchas will be there, and it will manifest as the Gulma also. And Sarvanga Kubide Vada. Sarvanga Vada, if located in all over the body, Vada if located, twitching sensation will be there. breaking type of pain will be there. Sarvanga Kubide Vade Gatra Spurana Bhanjane Vedanabhi Paridascha Pudantiva Asti Sandhya. Sandhis Pudana will be there. This kind of different type of pain all over the body. Sandhis Pudana will be there. Twitching type and breaking type of pain will be there in the body when it is located in Sarvanga. Then this we have seen Vada located in the Guda Marga, which also will be obstructed. Graha of Vit Mutra Vada. Usually the anulomana should be happening in the beginning of Vada Vyadi. I have mentioned the proper functioning of Vada. If Vada is localized in different places and functions properly, that will lead to the healthy life. That will cause or that will be leading to a healthy life. The main function of Vada, especially Apanavada, is Anulomana and elimination of this waste material. Here, if Vada Prakopa occur in the Guda Marga, this obstruction of Vit, Mutra and Vata will happen. Retention of stool, urine and flatus will be there. Different type of pain in the abdomen and lower abdomen will be there. Another thing is that Vata obstructed or Vata vitiation in the Guda can cause the Ashmari. Ashmari and Sharkara. This calculi will be formed due to the obstruction of Vata. And usually in our clinical practice, in general or clinical practice, patient may come with a pain in the calf region, pain in the thighs, pain low back. We will suspect about the in disc bulge or disc prolapse or such kind of problems regarding the vertebral column or nerve root in the low back region L4 L5. Such kind of assumptions we will make. But some another cases, if pathology even if not there in the joints or vertebral or spinal column, these symptoms will be existing. Such conditions we should go for the Vada Vritti in the Pakvasya or Amasya or Guda. So they just mentioned the classical reference here is Triga Pada Prishta Roga will occur when the Vata is located in the Budasthana. So that will be that should be noted while consulting a patient who is expressing with the symptoms of pain in the lower half of the body or pain or different catching type of pain in the lower half of the body. In Vata, if it is located in the Amasya, different problems of Amasya will be there. That stomach umbilicus, side of abdomen will be having pain. Thirst will be there. Diarrhea may be there. Cough will be there. So dryness of mouth will be there. So even if symptoms are there in the throat and mouth, we have to see, we have to consider the Vata located in the Amasya. Amasya the Vata can cause Swasa, dryness of Kanda, Asya, Chosha, Kasa will be there. So Kasa, Swasa, Kanda, Asya, Chosha, if we see, we have to think about the vitiation of Vata even in the Amasya. And if it is located in the Pakvasya, if it is located in the Pakvasya, Kritra Mutra Pureshatvam. Kritra Mutra Pureshatvam. Mutra Puresha will be in the eliminated Kritra, very scanty elimination of Mutra and Puresha will be there. Anaha will be there. Anaha is the flatulence or distended abdomen will be there. Trika Vedana. Trika Vedana also pain in the lumbar area. Pain in the lumbar region will be there. That is what I mentioned in the last portion also. Where if we patient is explaining or patient is representing with the symptoms of pain in the low back or lower part of body, we have to think about this Ashegada Vada also. Pakvashegada Trigavedana is mentioned. In Amashegada Vada, Kasa, Swasa, Kandhasi, Shosha is mentioned. In Gudagada Vada also, the pain in the leg, thighs and calf region is mentioned. Low back also mentioned. And Indriya Gada or Vata is located in different Indriya. We have seen in the last class that functions of Indriya will be impaired. If it is located in the Twak, twak, if it is located, dryness of twak will be there. Pricking pain of pricking type of sensation in the skin will be there. Stretching type of pain will be there. Stretching of skin will be there. Discoloration of skin will be there. Such symptoms will be there. We can observe while the vata is located in the twak. And if it is next, if it is located in the rekta dhatu, similar symptoms of vata rekta will be observed. Acute pain will be there, burning sensation will be there, discoloration will be there, and krishada will be there, karsham will be there, and some type of rashes will be appeared in the body when vata is located in the rekta dhatu. So skin manifestations will be there in the when while vata locate in the rasa dhatu or tvak dhatu or and rakta dhatu. These two type visheshan or vata visheshan in the these two dhatu will be manifested as the symptoms of the skin. Next, if it is located or if it is vitiated in the mamsa dhatu, mamsa and medo dhatu, guru anga gurutva will be there. Heaviness of body will be felt if it is located in the mamsa and medas. Saruk, pain will be there. Muscle pain, body pain will be there if it is located in the mamsa and medas. And fatigue will be there. Tiredness will be there. Different in this condition, excessive fatigue will be there. Will not be able to do different type of activities. Such symptoms are observed in case of vata vitiated in the mamsa and medas. Pain will be severe, like he got a hit from the blunt object. Such pain will be there if it is located in the mamsa and medas. Next, we will see when vata is located in the asti and majja. Asti majja gada will definitely manifest as the joint pain. Cracking sound in the bone and joints, piercing type of pain will be there, and all the joint pathologies will be in Bhedo Asti Parvanam Sandhi Shulam Mamsa Balakshaya is the symptom. Mamsa Balakshaya will be there, Sandhi Shula will be there, different type of sound, that cracking sound will be there, crepitus will be there. Such things will be observed if it is Vada is located in the Asti and Majja. When it is located in the uh, Shukra Dhatu. Shukra Dhatu, as we know, the patient or the person will be unable to produce offsprings and ejaculation will be affected. It can be premature ejaculation or it can be retention of semen inside. Premature expulsion of fetus will be there if it is located in the garbha. So that symptoms we have already seen in last class. And if it is located in the asti, sandhi, that kandara, etc., that kind of different type of pain, snayu kandara, if it is affected, different type of pain will be seen in the that localized area. Okay. Then we have seen last dhatu sandhigada vada purna dridisparsha shobha sandhigade anle prasarana agunjane pravartista vedana, that we have seen already. And Ardita, we have seen Ardita in Ashtanga Hridaya as half part of face will be affected, and movement of face and movement expressions of face will be affected. In Charaka Samhita, it is mentioned as the signs, these symptoms can be occurred in the half part of body also, and if it is occur in the face, it both can be happen. And this is mentioned as ardhita, arthe, sharira arthe, or shiro, or half part of body will be affected. Adhivriddha vada will affect in the half part of body. Adhivriddha sharirartha megam vayum prabadyate. Charaka mentions as this vitiated vada will be affecting in the half part of body, and different type of activities of face or that part of body will be affected. Contractions of arm, foot, knee, this will be affected, and the normal curvature of face will be affected, nose, eyes, etc. Normal functions of movements of eyes, face of one side will be affected. The patient will be unable to talk, the speech will be affected. Vakri Karodi, Nasa, Ru Lalada, Akshi, etc. These deformities will be there. This types of lakshana we can see in the Ardhida. And while ayama, that also we have seen in the last class, antarayama and behirayama. Antarayama is the curvature or the stretching or spasticity uh, towards internally. Forward will be there, forward contractions will be there in the antarayama, and backward will be there in the behirayama. In antarayama and behirayama, the part affected is manya. Manya is the part between sternum and neck area. That neck and sternum area that is affected, and contractions will be there. Some contractions patients will go internally, the bending internally, that is called as antarayama. If it is backward, then it is called as behirayama. Next one is hanugraha. That also we have seen hanugraha. Hanumula, vata is affected in the hanumula. That can cause uh, either opening, either the mouth will be open, remain opened, or the mouth will be remaining closed. That is seen in the hanugraha. Akshepaka convulsions are there. Akshepaka is convulsions. Convulsions will be there. And Pakshakhada. Pakshakhada is one part of body, half part of the body is completely affected, and the loss of movement ability will be there. Hatvegam Marudah Paksham Dakshinam Vamameva. Dakshinam Bhaga or Vama Bhaga is affected. Half, either left half or right half is affected. Kuryat Cheshta Nivarti. Kuryat Cheshta Nivarti. Cheshta is activities. Kuryat Cheshta Nivarti is activities will be restricted. Rujam Vakstambameva. Rujam, pain will be there, Vakstambam will be there. Grihitva Artha Sharirasya. Tira, half part of the body will be completely affected. Grihitva Artha Sharirasya Tira, half part, all the Tira will be affected. Tira Snayu Vishoshita. Tira and Snayu are responsible for the movement and other activities that will be completely stopped. The functions will be completely stopped and affected. So that half will be functionless. Sankoja will be there. Padam Sankoja Tegam Hastam Va. Pada or Hasta Sankoja will be there. Toda Shula, different type of pain will be there. Ekanga Rogam Samvidya Sarvangam Sarvadehajam. Ekanga Roga, if it is affected in a part of body, it is Ekanga Roga. It is mentioned as Ekanga Roga. If it is affecting the whole body, it is called as Sarvanga. So, Pakshakhada or this kind of Vada Visheshan, depending on the part or depending on the area affected, it can be Pakshakhada, Ekanga, Sarvanga Vada. If it is affecting a localized or a part of body, it can be Ekanga Roga, that can be considered as monoplegia, and Sarvanga can be affected all the body, whole body. If it is affected, it can be termed as Sarvanga, and half part it can be Pakshavadha or Pakshakhada. It can affect either a left half or right half of the body. That Gridrasi also we have seen. Next disease is Gridrasi, that also we have seen in Ashtanga Hridaya. In Charaka, the cause of pain is mentioned. That is very important. Hik Purva, Kadi Prashta, Uru, Janu, Janga, Padam, Kramat. Hik Purva. First it is starting with the Hik Purva. Kadi Prashta, Kadi, Prashta, Uru, Janu, Janga, Padam. This is the order of affecting. First it is affecting the buttocks, then it is low back, thighs, knee, and later to the legs or calf region it is affecting. In sciatica, we can see the very similar symptoms affecting the sciatic nerve. Gridrasi Stamba Ruktoda Dirhnadi Spandade Muhu. Gridrasi Stamba Ruktoda. Stambana will be there. Ruk pain will be there. Toda also a type of pain will be there. These symptoms will be manifested. And two types of Gridrasi mentioned, Vada and Vadakapha. Vadakapha are there. Vada will be, two types can be seen in the patient. Vadika type of Gridrasi and Vadakabhaja type of Gridrasi. Next is Khalli. Khalli to affecting in the both uh, hands and legs. It is affecting is called as Khalli. We can move to the Samanya Chikitsa. This is just I have given a glimpse on Nidana or Lakshana part. We will move on to the Chikitsa part. If we see the Chikitsa Sutra, Kevalam Nirupastambam Ado Nehe Rupajare Vayum Tarpir Vasa Majja Vasa Taila Majja Panir Narantataha Sneha Klantam Samashwasya Payobhi Snehet Puna Yushir Gramya Ambu Ambuja Anuparasirva Sneha Samyutehi Payase Kristare Samla Levane Lanvasane Navane Sarpane Chane. This is the treatment principle of Vatavyadi. This is what we have already seen in Ashtanga Devas. Kevalam Nirupastambam. If it is Vatavyadi, if it is not associated with other doshas, if it is not associated with other doshas, Kevalam Nirupastambam, not associated with Ado Snehe Rupacharit. You can go for Snehana. As we have seen in the last class, Snehana and Svedana are the main treatment for Vatavyadi. And ultimately, we have to go for Snehana in a Vatavyadi. Whatever treatment we give in prior to the Vadavyadi Snehana Chikitsa, but finally we should go for the Snehana therapy. So Snehana is very important. Kevalam Nirupastambam Ado Snehe Rupajare Vayum Sarpir Vasa Taila Majjapani Naratada. Different type of Snehana, different kind of Snehana can be used for Snehana. Sneha Klandam Samashwasya. Once you give Snehana, once you give Snehana in a large quantity, that patient will be getting tired with the Snehapana. Sneha Klanda. The patient will lead to Sneha Klanda. Samashwasya Payobi Snehetune. Again, it should be Snehana should be continued after Samashwasya. Samashwasya Snehetuna. This already we have seen. After Snehana, Samashwasya again Payase Kristere. Sneha Samyukta Ahara should be Sneha Yukta Ahara. Payasa Kristera, etc. can be given. Anuvasana Navana Tarpana. Anuvasana Navana Tarpana. These are different modalities of giving Sneha Prayoga, Snehana in a patient. It is any kind of Snehana procedure we can adopt for the patient of Vatavyadi. After this Snehana, it's very important to have Svedana. Svedana can be given by Nadi, Prastara Sangare, Susniktam, Svedetada, Subjectam, Sneha Samyuktir, Nadi, Prastara Samhidehi. Sangarehi, Swabhyaktam, Sneha Samyuktir, Nadi, Prastara Sangare. Nadi, Prastara Sangara, different type of Sveda can be used. It is mentioned in the Sveda Adhyaya, any kind of Sveda Prayoga can be used. This benefits of Svedana we have seen in the last class also. Harshatoda Rugayama Shobha Samba Grahadeha Vinnasyashu Prasamyanti Martavam Chopajaya. These are the benefits of Svedana. And as we have seen last classes on simile, I have mentioned even the dried piece of food can be bent by applying the Snehana or oleation. Similar way, if you apply Sneha Sveda in a living body, we will be very easy to manipulate the joint, or we will be very easy. We can make the joints or body very flexible. Vada will not stay in the body where we apply Sneha Sveda. Snehasta dhadun samsushkan pushnatyasu vyojida balam agni balam pushtim pranasta. These are the benefits of Sneha and Sveda therapy, Snehana and Svedana, that we have already seen in the last class also. This is Shodhana. Next is Shodhana. Shodhana is also important. Etyedena sadoshatvat karmanana prasamyati. This type of uh, sneha sweda you have given, if you have given, it is not subsided. If it is not subsided, and you can go for chodhana therapy. We have seen in the Nidana of Vadavyadi, improper administration of therapies can cause vitiation of Vata, and that can cause the uh, Vadavyadi. So, if you while you are applying a therapeutic measure or while applying a treatment in a patient, we have to be very careful, even if it is Shodhana or Snehana. We can see it if a patient is of Vadavyadi, we observe or we assume it as Kevala Vada, and if you give Snehana, that Snehana will, this Snehana may cause ama, or it can go undigested, or it can cause ama by patient's other activities, day sleep or other activities. It can go for, it can go as ama. Then we have to stop and we have to go for Pajana Drivya. Whatever the treatment, even if it is Snehana or it is Chodhana or it is Rokshana or any kind of even Svedana, therapies should be very carefully applied in a patient, especially in the case of Vada Vyadi. The therapies itself can cause Vada Visheshan. So, Chodhana can cause Visheshan of Vada, but in Vada Vyadi, after applying all this Sneha Sweda procedures, if it is not subsided, we can go for Shodhana by carefully observing the patient. Shodhana can be Mridubi Sneha Samyuktehi. Mridu Sneha can be given. Sneha Samyukta Shodhana, Sneha Samyukta Shodhana can be given. Usually in clinical practice and also in the classical reference, Payas Erenda Tailamba, Payas and Erenda Taila is suggested by Acharya for Virejana. Erenda Taila mixed with, or Erenda Taila with the Anubana. Payas Anubana can be given. Vived Dosha Haram Shivam. It is mentioned as Dosha Haram Shivam. Very Shrestha in Dosha Samanatva. Erenda Taila with Payas is mentioned as very Shrestha in for Dosha Hara. So in a Vadavyadi, if you want to give Shodhana, it can be given. Shodhana can be given with a Snehadravya. In Snehadravya, you can go for Erenda Taila. For Erenda Taila, you can give Anupana, uh, Kshira as Anupana. Kshira as Anupana, it can be given. Then Snehana can be given again. After Shodhana, Snehana can be given again. Srodho Rodha, if you see, there is Srodho Rodha. Anulomana should be given again. Again, after Shodhana, we can give for Snehana. While seeing the, while administering the Snehana therapy, if Srodho Rodha, if it is there, again Anulomana should be applied. Srodho Bhattva Anilam Yudhya Tasmat Tad Anulomayet. Anulomana should be done if it is obstruction. Uh, After giving Snehana. Snehana always Kledatva is there. Sneha Bhava, Sneha Alingani. Sneha Bhava is there. Sneha will can cause always obstruction. So if it is excess or long term, that will cause, or that may cause obstruction of the Srotas. As we know, obstruction of Srotas is again causative factor of vitiation of Vadavritti. So we have to stop there and we have to go for Anulomana therapy. Then if it is patient is avirejya, Anulomana, we can go Anulomana if the patient is not fit for Chodhana, Virejana, Avirejya, you can go for Niruha. Niruha, Pajana Devana Kriya. If it is even if no not fit for Anulomana, can go for Pajana and Devana. So everything we have to see very carefully. That is, Snehana can be given. Snehana should be given in a patient of Vadavyadi. Sneha Klanta should be given a gap or Samashwasya. Again, Snehana should be given. If this Snehana procedure is causing the obstruction of Srotas, then you can go for Anulomana. If patient is not fit for Anulomana, or if it is not fit for Virejana Aviretya, you can go for Niruhavasti, or even if it is not possible, you can go for Depana and Pajana. After this procedure, our main aim is to give Snehana to alleviate Vata. So again, Snehasveda should be given. That Snehasveda can be given with a Swadamla Lavana Snikta Ahara. Can be in terms of food materials, it can be again given. Then Navana and Dhumapana can be given to avoid excess Kledatva of Snehana. So to maintain, to nourish the body and to subside or to alleviate Vada, we have to go for Snehana procedure. And to maintain the Snehana, it should not be go in excess. For that, you have to go for Pajana, Depana, Anilomana, Chodana, Niruhavasti, Navana, Dhupana, etc. in between. This is the treatment principle of Vada Vyadi. Then the treatment of Gata Vata. We have already seen last class and just before the Samanya Chikitsa, I have mentioned Vata located in the different places. Koshta, Guda, Pakwasya, Amasya, Sarvangavada, Tvagada, different Dhadugada Vada we have seen in the last, just before mentioning the Samanya Chikitsa. Here, the specific treatment of each are mentioned. First, we can see the treatment of Koshtagata Vada. विशेषस्य कोष्ठस्थे वादे क्षारं पिबेत् नरः. Ksharam pibet nara. Kshara prayoga. Paniya kshara is mentioned for the treatment of vata located in the koshta. Pachaner, deepaner, yukter, amlairva, pachayet malan. Deepana, pachana, and amlarasa. The aim that vata is located in the koshta. If vata is located in the koshta, we have to koshta, as we know koshta, there will be annarasa, anna will be there, pachana is very important. We should not give any vada aggravating or vada increasing procedures should not be given. Chara is mentioned here, that is ama or any kind of kledatva, snigdha. These kind of qualities are causing the visheshna of vada in koshta. So we have to remove this obstruction. We have to remove the kledatva. We have to digest the undigested material. That is the aim of treatment if it is vada is located in the koshta. Usually, visheshna of vata in koshta will happen because of the undigested material in the koshta or sneha or kleda, as I mentioned earlier. So for that, Paniyakshara can be given. Deepana Pajana, different Aushada having Deepana and Pajana properties can be given. Amlarasa. Amlarasa is given. Amlarasa should be dominated in the Bhajana or whatever the treatment or medicine if you are giving, Amlarasa to be added with the Deepana Pajana Aushada. That is the treatment mentioned for Vada Vyadi, for Vada located in the Koshta. Next, Guda Pakvashestam. Guda Pakvashesta. And if it is located in the Guda and Pakvasya, Guda Pakvasheste, Karma Udavartana, whatever the treatment mentioned in the Udavarta. We know in Udavarta, Vata Anilomana is obstructed. The Apana Vata Anilomana is obstructed, and the obstructed Vata will move upward or in the opposite direction. That is in case of Udavarta. So the treatment we are giving or we have to plan in Udavarta is Anilomana. Anilomana should be given in the Guda Pakvashesta Vada. Why Vada is located or Vada is vitiated in the Guda and Pakvasha? Vada is vitiating in the Guda and Pakvasha because of the obstruction. It can be the obstruction of fecal matter, it can be obstruction of undigested material, or it can be the obstruction of Kabha or Pitta or any other dosha. this vitiated dosha can cause the obstruction of vada. Thereby, this Guda Pakvashesta Vada Pragoba will occur. And as we have seen earlier, the symptoms will be there like low back pain, calf muscle pain, similar symptoms will be there. So, simply giving anulomana, that low back ache, calf muscle pain, thigh pain, everything will be subsided if it is due to the vitiation of vata in the Guda and Pakvasya. So if you understand very properly, the simple techniques and simple medicines can give very good results. For example, in Koshtagada and Guda Pakvasya Gada, if you give Gandharvastadi Kashaya is Pajana, Anilomana, that can cause Vada Shamanatva, Anilomanatva. Then again, it will subside the Vada, it will cause the Anilomana of Vada, and some symptoms will be subsided. So the formulations we will discuss later. Then by that time we can understand what kind of formulations effective in which type of vada. Next is Amashaya. Amashaya Gada Vada Shodhana and Doshahara. Which dosha is affected? Shodhana can be given. In Ashtangridaya we have seen Amashaya Gada Vamita Pradibhojane. Vamana is mentioned. Here it is Shodhana, just mentioned as Amasyaste Shuddhasya Yadha Dosha Kriya. Shodhana is mentioned. Ashtanga or Vagbhadacharya specifies which Shodhana. Specify as Vamana. Because Amasya is the Sthana of Kabha. Sthana Chikilsa, Sthanika Dosha Chikilsa should be given. So, if you want to give Shodhana in the vitiated dosha of Amasya, we have to choose the Shodhana as Vamana. That is what Acharya Vagbhada mentioned. Vamana, Amasyastu Vamida Pradibhojane, Sugambuna Shadharanam. Okay, that Pajana Ushada are mentioned in that context. Here also, Shodhana should be done. Amasyasta, Shodhana should be done, followed by Dosha Hari Kriya, Dosha Hari Kriya. Dosha Samana Kriya or treatments can be done. Not only Vada, whatever the associated dosha can be go for. Next is Vata in Sarvanga. Sarvanga Kubide Abhyango Vastayasta Anuvasana. Sarvanga Kubide Vastayo Abhyango Vastayasta Anuvasana. Abhyanga can be done. Vata Prakopa in whole body. Sarvanga, you can go for Abhyanga. Abhyanga is a good Snehana method, external Snehana method. It can apply all over the body. Oil can be applied all over the body so that Vada Shamanata occur in the whole body. Sweda also can be given. Niruha. Niruha is mentioned. Anuvasana. Anuvasana is a type of internal Snehana. So Anuvasana can be given. Niruha can be given. Sarvanga Kubide Abhyango Vastayasta Anuvasana. Abhyanga, Niruha Vasti and Anuvasana Vasti can be given in the Sarvanga. Niruha Vasti, as the term Niruha indicates, it is having an unexplainable positive results. So Niruha Vasti will be very effective if we are unable to locate the vitiation of dosha, or if it is located all over the body, vitiation of vata all over the body. It is a very good Shodhana procedure also. Without vitiating vata, we can go for Shodhana by using Niruhavasti. That is why I mentioned Niruha is mentioned here. So, Sarvanga Kubide Abhyango Vastesti Anuvasana. Vasti here is Niruhavasti Anuvasana. Can be given. Anuvasana also can be given Anuvasana as a Nehana procedure. Twakste, what we have can give for if it is located in the Twak. Twagashra, Sweda, Abhyanga, Avagahascha, Krityam Channam Twagashtrate. Sweda, Abhyanga, Avagahascha, Krityam Channam Twagashtrate. Swedana can be done, Abhyanga can be done. It is same as mentioned earlier, Snehana and Swedana. Swedana, Abhyanga is external Snehana, Swedana and Abhyanga, Sneha Sweda is to be done. Avagahascha, Avagaha is also a kind of Swedana therapy. Avagahascha. Sweda Hridyam Channam Twagashtrate. Hridyam Channam. What is the relevance of Hridyana? Hridyam Channam Twagashtrate. Hridyana Twag is here indicates the Rasadhadu. Twag here indicates the Rasadhadu. Rasadhatu Visheshan it happens, or Rasadhatu Visheshan occur in the body, it is directly related to Ahara or Anna. So, the favorable Anna for the Rasadhatu to be given in vitiated Rasadhatu. That is Hridyam Jana. Hridya is the not only pleasing or for pleasure for mind, it is favorable for Rasadhatu. That is for Hridyam Jana. So Gastri. Not for no, Hridyam doesn't indicate only for placing food or food is which is pleasing to mind. It is pleasing to Rasadhatu, or it is very healthy for Rasadhatu, which should be very easy absorbable, and it should be of course mind also related with Rasadhatu. If you are happily eating, or if you are focused, if you are giving focus and to the food, and you are interested to take food and taking very happily and with a calm mind, it will be digesting very easily, and Rasadhatu will not be vitiated. So that kind of meaning should be taken here for Hridyam cha Annam Twagastri. Next, we will move on to the Raktastha. If the Vata is located or vitiated in the Rakta, Raktaste, Shita Pradeha Raktaste, Vireko Rakta Mokshanam. Shita Pradeha Raktaste, Vireko Rakta Mokshanam. If it is located in the Rakta Dhatu, Vata vitiation, and located in the Rakta Dhatu, Pradeha. Pradeha is external application of medicines. Pradeha to be given can be external application of ointment or any kind of medicated thing. Rakta Vata Shamana material can be applied. And Virejana, Virego Rakta Mokshana, Virejana and Rakta Mokshana. Virejana is a good treatment for vitiation of recta. When we see the treatment of Vata recta, we can see Virejana as one of the main treatments. So, vitiation of recta, if it is there, Shodhana is good. Among Shodhana, Virejana is very good. Pittaspretva is there, so Virejana will be very good modality for vitiation of recta. So, that is why, if it is located, dosha vitiation or Vada Vriddhi or Vada Visheshan in Rakta Dhadu, it is mentioned as Virejana. Rakta Moksha, as we know very clearly, Rakta Moksha is the treatment for Rakta Dhadu Visheshan. So, Pradeha, Virej. Pradeha should be, the medicine for Pradeha should be selected on the basis of Dosha Dushti. That is, Rakta Prasadana drugs should be taken for Pradeha. Okay. Then Mamsa Medastha. Mamsa Medaste. If Vata is vitiated or located in the Mamsa Medo Gada Vata, Vireko Mamsa Medaste Niruha Shamananija. Vireko Mamsa Medaste. Mamsa Meda are the dhatu which is having more kledatva. More kledatva, Mamsa and Medas. So, considering the sthana, vitiated dosha is Vada, but the location of vitiation or sthana of vitiation is Mamsa Medo. So we can go for Chodana. Virejana to be given, Niruha Vasti can be given, Samana Ushada can be given. If Vada is located in the Mamsa Dhadu or Mamsa Medo Dhadu, Chodana to be given, Virejana in terms of Virejana. Usually, other Vamana is not preferred in the Chikilsa in the treatment of Vada Vyadi except in the Amashigada Vada, because it can cause vitiation, again vitiation of Vada. But Virejana, if you give Snehadravya or if you give the medicine of choice without vitiating Vada, it may not it may not vitiate Vada. If it is given excess, it can be, but in a proper manner, it will not vitiate Vada Virejana. That is why in Vada Vyadi, Virejana is mentioned. Mansa Medogada, because of Sthana Pradhanyada, Virejana is mentioned. Niruha, as I told, Niruha is very effective. Vada Shamanatva, and if it is Mamsa Meda is whole body located part, so Niruha will give very good result. Shamana, Vada Shamana, Aushada can be given in the Mamsa Medastha. And in Asti Majjagata, next is Bahya Abhyantaraga Snehir Asti Majjagatam Te. Asti Majjagata. Almost all the Vyadi, Vada Vyadi we have come across will be having the visheshna of Majja Dhatu. Asti Majja. Majja Dhatu will be there because joints are affected. All kind of joint pain. Whatever the Vada Vyadi, in which joint pain is a symptom, there will be visheshna of Majja Dhatu. So, Vata, if it is located in the Asti Majjagatam, Bahya Abhyantarataha Snehe Asti Majjagatam Snehe. Why Bahya Abhyantarataha Snehe? Asti is the dhatu which is having Ruksha Guna, Ruksha property. So, if it is again Vata Visheshan again in such a dhatu will cause severe Rukshatva. So we have to go for very potent Sneha Prayoga. So Bahya Abhyantarada Sneha. You can give any type of Snehana internally and externally. Whatever Snehana, how much Snehana possible we have to give in the Asti Majjagadavada. Bahya Abhyantarada Sneha, Asti Majjagadam Jayet. Asti Majjagada should be treated with external and internal Sneha that can be Abhyanga, Taila Parishega, Murtini Taila, any kind of Snehana external. Similar way, internal also can be Snehapana, Samana Snehapana. It can be in Achapana, can be given. Different type of Vasti, Matra Vasti, Snehasti can be given. So any way, whatever the possible ways you can give Snehana, that can be applied for a patient with the Asti Majjagada Vada. Next is Shukragada Vada. Shukragada Vada. Shukragada, as we have seen, different, it will affect different functions of Shukra. Main function of Shukra is Garbhodpadana, that will be affected, and elimination of semen. Shukra elimination of semen will be impaired. Either excess elimination or no ejaculation. That kind of vitiation will be there if Vada is located in the Shukra Dhatu. So treatment is Harsho Annapanam Shukraste Bala Shukrakaram Hidam. Harsh Annapanam Shukraste Bala Shukrakaram Hidam. Whatever the activities which promote the sexual interest, excitement, production of semen, that kind of food, drinks, and activities should be promoting the strength as well as the quality of semen to be given for the patient in whom the Vada is vitiated in the Shukradhatu. Harsho Annapana. Harsha is therapy for excitement, sexual excitement. Harsho Annapanam. Ahara and Pana. Anna and Pana. Bala Shukrakaram. Increasing the strength, quality of semen, and increasing the strength should be given. Vibadha Margam Drishtadu Shukram Dadyat Virejana. Vibadha Margam Drishtadu Shukram Dadyat Virejana. Vibadha Marga, if we have seen Srodharoda or obstruction is there in the Srodhas, either Shukravada Srodhas or it can be because of Srodharoda. If you observe the vitiation of Shukra or location of Vada in the Shukra Dhatu and it shows the symptoms of obstruction, you can go for Virejana. Vibadha Margam, Drishtvadu, Shukram, Tadyad, Virejana. Virejana can be given. Virikta Pradibhuktasya, Purvoktam Karet Kriyam. After Virejana and Pradibhojana. Pradibhojana is Samsarjana Krama. Viriktam Pradibhuktasya, Purvoktam Karet Kriyam. Mention the therapeutic measures mentioned here can be applied after giving a Shodhana. So, Vada vitiation in the Shukradhatu. If Vada is vitiated in the Shukradhatu, you can go for Bala Shukrakara Kriya. Bala Shukrakara Kriya and Harsha. Harsha is sexual excitement or whatever the stimulation for sexual activities, whatever possible can be given. And the medicines Aushada, Ahara, and Pana. Anna, Pana, Aushada to be given, which can increase or improve the quality of semen, Shukra, and also Belya to be given. And if you see it is obstructed, otherwise, if it is obstructed and you are giving Shukra, Kara, Ahara, and such activities, food, and etc., that will again cause Vata vitiation because Marga Avarodha is there. If you see there is Marga Avarodha, you have to go for Shodhana, that is Virejana. After Virejana, you can go for Samsarjana Krama. After Samsarjana Krama, you can after Samsarjana Krama, you can give the therapies mentioned in the earlier, that is Shukrakara and Harshana can be given. Next is Garbhagada. Garbhagada. Garbhagada Vata, as we know, the fetus will be affected. It can be causing the depletion of fetus, or it can be elimination of fetus without any without the proper growth that can cause. So if it is Shukragada, sorry, Garbhagada, Garbhe Shushketu Vadena Balanam Chapi Shushidam. Vata, if vitiated in the Garbha, it will cause the vitiation or shoshana of fetus inside. What you have to give Sita, Kashmirya, Madhukir, Idam, Utthabane, Payaha. Payas process, milk processed with Sita, Kashmirya, and Madhuga to be given. Why this is given? This is Tarpana. Well, Shira is Tarpana. Shira processed with Sita, Kashmirya, Madhuga will enhance the dhatu, and thereby Garbha Shoshana will be prevented. We have to we have the aim to produce or aim to increase portion of Garbha. Garbha Poshana is our aim. For Garbha Poshana, this kind of Tarpana Aushadha can be given. By this Tarpana Aushadha, Garbha Shosha will be prevented, and the health of fetus will be improved. So Garbhagada Vata should be treated. Garbhagada Vata will cause the Shosha of fetus. So Garbhagada Vada should be treated for the Poshana of fetus. So, Payas can be given Sita Kashmiri Madhuke Siddham Utthabane Paya. Next is treatment of Vada vitiated or Vada located in the Hridaya. Hridi Pragupide Siddham Amshumatya Payohidam. Amshumati Siddha Payas. In Ashtanga Hridaya, we have seen the Sthira Siddha Payas. Sthira is Shaliparni and Prishniparni. They are mentioned here. Amshumati that can be taken as Shaliparni and Prishniparni. Amshumati Dwayam is the term used for denoting Shaliparni and Prishniparni. Shaliparni, Prishniparni are the well-known drugs for the diseases of heart. So, vitiation of Vata or vitiated Vata, if it is located in the Hridaya, it can cause different diseases of heart, and it can be treated with the Amshumadi Siddha Payas. Amshumadi can be both Shaliparni and Prishniparni can be. Next is Nabhi. Matyan Nabhi Pradeshaste Siddhan Villa Shaladu. Same mentioned in Ashtanga what we have said. Matsya processed with the Villa Shaladu. It can be given, and it can be given for the patient with the vitiation of Vata in the Nabhi Pradesha. And we will move on to some specific conditions, treatment of some specific conditions mentioned in Charaka Samhita. Veshtana, cramps and contractures. Vayuna Veshtamanetu. Veshtana if it is there, and Sankoja, contractures. Sailam Sankuchide Abhingo. Sankocha or Sankuchida, that is contractures. Veshtana is cramps. Veshtana and Sankocha. Cramps and contractures if it is there. Upanaha is the treatment. Gatresya Jad Upanahanam. If Veshtana is there, Vayuna Veshtamanetu. If it is cramps are there, you can go for the Upanahana. Upanaha type of Veda. Upanahana can be, that is medicated medicines are applied over the particular area, and it is bandage. The bandage is done. That is Upanahana. Abhyanga with Masha Saindhava Taila. Thailam Sankuchide Abhyango Masha Saindhava Sadhida. Masha Saindhava Sadhida Taila to be given for Abhyanga. Upanaha also can be given with such Saindava or Vadahara Aushada, Kalka or Patra can be applied over the area, and it should be tied, bandage should be done. Very can be done for around approximately 6 hours. It can be done, and you can remove, and again you can use for the Ubanaha. That's so cramps and contractures is there. You can go for Upanahana and Abhyanga. Abhyanga example is given. Masha Saindava Sadha. Masha Saindava Sadhida. Taila can be given for Abhyanga. Bahu Sheshragada. Adho Napigada. Bahu Sheshragade. Nastyam. Bahu Sheshragade Nastyam Panam cha Auttara Bhaktigam. Bahu Sheshragada. If it is located in the Bahu Shesha. That is Ababahuga we have seen in the Ashtanga. Ababahuga Bahu Amsa Mula Sthido Vayu Sira Sankuchitatraga. That is here you can see as Bahu Sheshragada. Similar treatment, same treatment is mentioned. There also Ababaho Hitam Nastyam Panam Chauttara Bhaktigam. Here the same thing, Nastyam Panam Chauttara Bhaktigam. Bahu Sheshtagade Nastyam Panam Chauttara Bhaktigam. This is mentioned as the treatment for Bahu Sheshtagada. Next is Adhonabhigadavada Vasti Avapeda Sneha. Vasti Karmam to Adhonabe Shastiteja Avapedakam. Vasti Karma and Avapeda Sneha is mentioned or indicated in the treatment of Vada vitiated in the location Adhonabi. Adhonabi. If it is located Adhonabi, this is the treatment mentioned. Avapeda Sneha and Vastikarma. Next is Ardida. Ardide Navanam Murthni Tailam Tarpanamevacha. Same we have seen in Ashtanga Ardide Navanam Murthni Tailam Protrakshi Tarpanamevacha. Nadi Sweda Upanahasta Anupa Pisiterhita Anupa Mamsa Upanaha with Anupa Mamsa Navana Munitaila Tarpana. These are the therapeutic measures to be used in the treatment of Ardida. Ardide Navanam Murtini Thailam Tarpanam Evacha. Adi Svedopanahacha Anupa Pisiterhita Anupa Mamsa to be applied for the Upanaha. This is the treatment of Ardida. Medicines mentioned in the Ardida will be discussed later. Then Arthangavada, Arthanga Swedanam, Neha Samyuktam, Pakshakhade Virejana, Pakshakhada or Arthangavada, Nehanam, Neha Samyuktam, Pakshakhade Virejana. Always Neha Sweda, as I told in Vadavyadis, Neha Sweda is the treatment. In Pakshakhada, Nehanam, Sneha Samyuktam, Pakshakhade Virejana. Virejana to be given with the Sneha Dravya. Nehanam, Sneha Samyuktam. Swedanam, Sneha Samyuktam, Pakshakhade Virejana is mentioned in Charaka Samhita. And Snehanam, Sneha Samyuktam, Pakshakhade Virejana is mentioned in Ashtanga Hridaya. Sneha Sweda can be given, and Virejana, mainly Virejana in Pakshakhada, main treatment is Virejana for the purpose of Anulomana and Shodhana, Srodho Shodhana. Virejana is given. That Virejana should be given by using the Sneha Dravya. Okay. Next is Gridrasi. Gridrasi Andara Kandara Gulpa Siravasti Agni Karmaja Gridrasi Ishu Prayunjida. Sira Veda Agni Karma. Sira Vedana and Agni Karma is mentioned as the treatment for Gridrasi. So, sudden relief of pain will be obtained by giving Agni Karma and Sira Veda. So, very severe type of pain, very severe acute pain will be there in the Gridrasi. And in that, for subsiding pain, you can go for Siraveda or Agni Karma. Vasti is also mentioned as the treatment for Gridrasi. In Chakradatta, another mentioning is there, Gridrasyartham Naram Samyak Pajanadye Vishodhidam Nyatva Naram Pradiptaknim Vastibi Samupajare. That will be, I think that will be suitable for the clinical practice, Chikitsa of Gridrasi. This is for acute pain management, Siraveda and Agni Karma, but as a person of Kaya Chikitsa, you can go with this treatment principle. Gridrasyartham naram samik pajanadhyam vishodhidam. Gridrasyartham, the patient affected with the gridrasyartham naram samik pajanadhyam vishodhidam. Pajana should be given, then shodhana to be given. Pajanadhyam vishodhidam jnatva naram pradiptagnim. Once you understood that the Agnidipti is occurred, Jnatva naram pradiptagnim, Vasti samupajir, then Vasti should be given. So Vasti can be considered as the major, one of the major treatment in Gridrasi. Chakradatta explained Vasti to be given after doing Shodhana, Bhajana and Shodhana. Bhajana and Shodhana to be given, then it will cause the Agnidipti. After knowing the Agnidipti occur, then you can go for Vasti. That is mentioned in Chakradatta. Khalli. Next disease is Khalli. Both hands and legs are affected in Khalli. Ushna Upanaha. Ushna Upanaha is the treatment mentioned. Ushna Upanahana with the Payasa, Kristira, Taila, Kruda. Khalyantu Ushna Upanahanam Payase, Kristire, Mamse, Sastam, Taila, Krudanvide. This is mentioned in the mentioned as the treatment for Khalli. Next is the treatment for Hanugraha that we have already discussed. If it is opened, you have to go for closing the joint. If it is closed, you can go for opening the joint. Before moving or before manipulating, you have to give Sneha Sweda. So after giving Snehana Svedana, Unname Chibukam. That is upward movement to be done if it is open. If it is closed, you can open by applying pressure. This is the treatment method to be adopted in the treatment of Hanugraha. Next is this is the Samanya Chikitsa of Vadavyadi Sarpis Taila Vasa Majja Tega Abhyanjana Vasteha Snikta Sweda Nivadamscha Stanam Pravarananicha Rasa Payamsi Bhojyani Swadamla Labananicha Brahmanam Echatat Sarvam Prasastam Vadaroginam. This is very important in terms of examinations or theory exams. It is very important. This Chikitsa Sutra, Samanya Chikitsa Vadavyadi, Sarpi Taila Vasa Majja, Tega Abhyanjana Vasteha. Sarpi, Taila, Vasa Majja. 4 type of Snehadravya. 5 types Sarpi, Taila, Vasa Majja. 4 type of Snehadravya. Then Sweda, Sarpi Taila Majja, Tega Abhyanjana Vasteha. Abhyanga, Tega can be Sega is Parishega, Abhinga, external application. Vasteha can be Niruha and Anvasana Vasti. Snikta Sweda Nivada, Snehana and Swedana. Snehana and Swedana. Nivatamscha. Nivada is the patient should not be exposed to wind. That is Nivadascha. Thanam Pravarananicha. Covering with the blankets to maintain the temperature of body. Then Rasa. Rasa is Mamsa Rasa, Payamsi. Different Shira Prayoga can be given. Bhojyani, food with the proper Swadamla Lavana. Bhojyani Swadamla Lavananija. Bhojana or food materials dominated with the Swada Amla Lavana Rasa. Swadamla Lavanani. Tatradya Marudam Chandi. Swadamla Lavana. Madhura Amla Lavana or Vada Shamana Rasa. So Ahara or food should be of the properties Swadamla Lavana, having more dominated with these 3 rasa. Brahmanam Echatat Sarvam Prasastam Vadaroginam. Any kind of Brahmana therapy can be applied for the patient for a patient with Vadavyadi. For Vadavyadi, Vada Shamana is Brahmana. Brahmana itself is Vada Shamana. In the beginning, or in the etiology part, Nidana, Samprapti part, we have seen that Dhadukshaya is the cause for Vadavriddhi. Shaya is the cause for Vadavriddhi. Wherever the normal dhatu is depleted or kshaya occurs, in that place Vadavriddhi will occur. In Samprati, we have seen Rikta Srotas, that is somewhere some absence of dhatu or something is absent or vacancy occurs in any place, there Vata will get localized and it will vitiate. So our aim should be avoiding the places where dhadukshaya happening or riktada is happening. Should not keep any places empty. Should be filled with dhatu. That will create or that will indirectly give the indirectly prevent the vitiation of vata. So that is why Brahmanam Echa Tat Sarvam Prashastam Vadarogana or any kind of Brahmana therapy or any kind of Brahmana therapy you can apply, and that will be effective for the treatment of Vada. And then next is the importance of Taila. We have mentioned Snehana Svedana many times, and application of Taila is also we have seen. The treatment of Vata Vyadhi for a common person perspective, common man perspective, treatment of Vata Vyadhi is with Taila. Applying some oil, some Taila for Vata Vyadhi. That is common man perspective. Why it is happening? Why this much importance given for Taila in the Vata Vyadhi? That is mentioned here in Charaka Samhita Chikilsasthana. Nasti Tailat Param Kinchid Aushadam Marutapaham. There is no other medication which can excel or which can cure the disease of Vata. So, Nasti Tailat Param Kinchid Aushadam Marutapaham. Vyavai Ushna Guru Snehat Samskarat Balavattaram. Vyavai Ushna Guru Sneha property. Vyavai Ushna and Guru property of Taila and Samskarat Balavattaram. If you prepare or process this Taila with uh, Vata Shamana Aushadas, then it will be more beneficial. Vyavai Ushna Guru Snehat Samskarat Gunavattaram. Gunair Vada Hare Tasmat Sadasho Atha Sahasrashaha. You can prepare Satapaka and Sahasrapaka. You can prepare process many times, 100 times or 1,000 times with the Vada Shamana group of drugs. Vada Hara proper drugs with having Vada Shamana property. You can cook or process 100 or 1,000 times. That will be more potent and that will give more effect on Vata Shamanatva. Such Sneha, Siddham Shiprataram Handi, Sukshma Marga Siddhan Gadan. Sukshma Marga Siddha Gada. That is the Vada or vitiated in the Sukshma Marga. Very minute srotases. If it is vitiated with the Vada, also will be get cured by application of Avarti Taila. Avarti Taila is very common in the practice of Vada Vyadhi. 100 times Shatapaka, Sahasrapaka Tailas are available. This Shatapaka, Sahasrapaka, how many times you process this Taila, that much it will be potentiated, and dose also will be very less in requirement. If you give Taila processed with Vadahara Dravya directly, if you want to give 5 ml or 10 ml, if you use 100 times of Paga, that is Shata Paga, if you have done, then it will be dose will be very less. For 5 drops or 10 drops will be much effective. And if it is 1,000 times, Sahasra Paga, again the dose will be even 1 drop or 2 drop will serve the same effect. So, how many times you can process with the Vadahara Dravya, that much the medicine will be potentiated and that much the effect will be there as a Vada Shamanatva, and it can reach the minute Sukshma Srodas. It can penetrate to the Sukshma Srodas, that is Siddham Shipradaram. Very sudden effect will be there.
Sukshma Marga Sthitan Gadan. Sukshma Marga Sthita, very minute channels, minute srodhas. If it is vitiated dosha is there in the minute srodhasas, that will be this Avarti Taila will act on such places and reduce the vitiated vata. Okay. I think next is the Avarana. Avarana will take more than 45 minutes. We can wind up here, and Avarana can be taken in the next class.